Could a ketogenic diet help people with multiple sclerosis improve their functionality and their symptoms and their overall quality of life? A new study suggests that that might be the case. I'm Dr. Brett Scher, the medical director of DietDoctor.com, and multiple sclerosis, or MS, is a really kind of devastating disease without very good treatment or cure at this point. And a lot of the diseases that people manifest when they have MS are these chronic relapsing diseases that come and go, and you're never quite sure when it's going to flare, and it can really, really adversely affect quality of life with all sorts of neurological dysfunctions that are really disturbing for the individuals and for caretakers. But one thing that we know and are starting to learn even more of about ketones and ketogenic diets is that they're beneficial for neurologic conditions, multiple neurologic conditions, right? They're being investigated in a number of psychiatric and mental health conditions, with cognitive decline, with traumatic brain injury. Something about the brain and ketones seems to work pretty well, is like the simplistic way to say it. And Dr. Terry Wahls is sort of well known and famous for her multiple sclerosis protocol. And a big part of her dietary change that she promotes is more of a sort of whole foods paleo type program, which frequently can intersect with ketogenic diets. Well, now there's a phase 2 trial. So not a randomized controlled trial by any means, not a large trial, but a phase 2 trial called Phase 2 Study of Ketogenic Diets in Relapsing Multiple Sclerosis: Safety, Tolerability, and Potential Clinical Benefits. And this is important because when you're in a phase 2 trial, safety and tolerability are sort of more important really than the outcomes, which is kind of strange, right? But first you have to make sure something's safe in a certain population, and outcomes matter, but the outcomes usually tend to come later in the phase 3 trials, and then of course in the when it's out in clinical practice as well. So what they did for this study, they had 65 subjects, and they were enrolled into a 6-month ketogenic diet intervention. So there wasn't a control group, and that's important too, right? A lot of times we want to talk about randomized controlled trials with a control group, see if it worked better than what you're comparing it to. So in this one, that wasn't the case, again, because it was phase 2. Now, they did daily urine testing to monitor for compliance, and, urine tests are not the best. There definitely has some shortfalls. Blood tests or even breath tests are likely better. But even with the urine test, they found 83% adherence at the 6-month mark. So still pretty good. And there were significant reductions significant improvements in a number of the different markers that they were following as their primary outcome. So first, there was a reduction in fat mass, which is pretty good, right? That wasn't necessarily what they were shooting for in the multiple sclerosis trial, but that's a good finding. But a 50% decline in self-reported fatigue and depression scores. Now, we do have to have the caveat, like anytime someone's enrolled in a clinical trial and having clinical follow-ups and being paid attention to, there's you could call it placebo effect, the watch effect, the study effect, that people may just feel better because they're under a protocol. So that does have to be taken with a little grain of salt, but 50% improvement is pretty good. And they list a lot of the numbers for the scores they use, which are, it's kind of hard to interpret and know exactly what those numbers mean. But the percentage improvement is pretty easy to know what you mean. And so some of these scores are the physical health score, the mental health score, and the composite score, all improved on the diet. There's something called the Expanded Disability Status Scale score. They tested a 6-minute walk and a 9-hole peg test, which is sort of like a physical dexterity type of test, and everything improved on a keto diet. So that's really, really encouraging. Now, again, it doesn't prove it's more effective than any other diet. It doesn't prove it's even more effective than a placebo, but it shows that it's certainly safe in this population, it's well tolerated in this population, and for the preliminary findings that it is effective. So when you have a disease process that doesn't have many options, and something as simple, quote unquote, simple as a dietary change that has so many other potential benefits, including weight loss, improving blood sugar, improving insulin, improving body composition, potential mental health benefits, right? All these other benefits of following a low carb or ketogenic diet. Why wouldn't somebody try it to see if it helps their their MS. So it certainly seems at this point it's a reasonable alternative that should be an option for clinicians in seeing patients with MS. Now, future studies are definitely going to come to shed more light about if it's, better or worse than or same as other interventions. But with an intervention like this that you don't need a prescription, there aren't really side effects. We have so much information about the ketogenic diet on our website at dietdoctor.com about the basics of it, how to get started, how to monitor for safety, all those things. Once you've got that into place, why wouldn't you start it on someone with multiple sclerosis? Certainly an interesting question that we're going to see a lot more from, but I hope neurologists and physicians treating patients with MS take note and have this as a tool in their toolkit. All right. I hope this was helpful. If it was, please click the thumbs up and subscribe button, and we'll see you next time here on Diet Doctor News on YouTube. Thanks a lot, everybody.